Hi everyone, today we will discuss about diabetes mellitus. What is diabetes mellitus? What are the types and types, signs and symptoms, and its management. So first we will discuss about functions of pancreas. So pancreas is one of the major exocrine gland. It will synthesize the juice, that enzymes that promotes the digestion of carbohydrates, proteins and fats. First, the important alpha cell synthesis and secrete the glucagon, beta cell synthesis and secrete the insulin, and then delta cell synthesis and secrete the somatostatin and the gastrin. So first, what is diabetes mellitus? It's a group of metabolic disorders. Characterized by hyperglycemia. Hyperglycemia means increased blood sugar level resulting from the defects in insulin secretions. Either it will be a decreased secretion of insulin by the pancreas or decrease the action of insulin, or otherwise both will be affected. Whatever the risk factors for diabetes mellitus, first we will be divided into two types: non-modifiable and modifiable. Non-modifiable means we couldn't be changed. Modifiable means we can change the factors. Age is 45 or more. Race: African American, Asian American, Hispanic and Latino peoples commonly affected with diabetes mellitus. Family history of parents and siblings with diabetes, we are prone to get the risk for diabetes mellitus. Modifiable risk factors for pre-diabetes, whose blood glucose level more than 140 in fasting blood sugar, and heart and blood diseases, hypertension, low HDL cholesterol level and high triglycerides, obesity, polycystic ovary syndrome and physical inactivity, that is sedentary lifestyle. Types we will be divided into two types. First one, type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 is nothing but first decreased secretion, insufficient insulin secretions. So it is called as juvenile or insulin dependent diabetes mellitus. It is one of the autoimmune destruction of pancreatic beta cells. Individual has absolute insulin deficiency and no producing the insulin in our body. Such the patient is absolutely dependent on insulin, external administration of insulin for survival. Type 2 diabetes mellitus, insulin will be secrete that is not adequate for the maintenance of normal blood glucose level. First, stomach converts the food into glucose. The glucose enter into our bloodstream. The pancreatic produce the sufficient insulin, but it is resistant to effective use. What will happen? Glucose unable to enter the body effectively. Glucose level will be increased. That is the reason always we are manifestation with these symptoms. What are the signs and symptoms we will discuss in type 1 diabetes mellitus? First, excessive thirst, excessive hunger, unexplained weight loss, blood division, slow healing of cut and sores, so decreased healing status, fatigue, always feel tired, vaginal yeast infection, frequent urination, including that frequent full diapers, bedwetting in children. Type 2 diabetes mellitus. So first we will have the dizziness, always hungry, tingling sensation in the peripheral region, increased thirst, fatigue, vomiting. Sometimes we will have weight loss, headache, frequent urination and blurred vision. Okay, so what are the management? So we need to first monitor our blood glucose level. So maintain the diary to monitor fasting blood glucose, postprandial blood glucose and HbA1c level. So balanced nutritious food we need to take. Carbohydrates counting, whatever the carbohydrates we are taking, we should monitor. Medications, it's based on the physician prescribed medications. Yoga and exercise we need to do. So first, oral medication. So metformin, sulfonylureas, talbutamide, acidoximide, tolazolamide, chloropramide, second generation of glimepiride, glucosidase inhibitors. All those things will be oral medications. And insulin therapy. Insulin therapy is based on the needs of the patient. Short-term use, long-term use and intermediate acting. Short-term use is used for acute illness, any surgery, any stress and emergency situation like diabetic ketoacidosis. All those things we will use. So that is actrapid, Humulin. Long-term use, Toujeo, Lantus. Intermediate acting, Humulin N, Novolin N, insulin NPH. bypassic insulin, Humalog mix, Humulin M3, Nova mix. So these are the long-term use. So insulin site is very important while we are practicing with the type 1 and type 2 diabetes mellitus. So insulin dependent diabetes mellitus patients, front side abdomen we need to put, and sometimes we can use thighs. In back side, upper and outer of the arm, buttocks and side of the thighs. The most common preferable site for insulin is abdomen because it will give the bioavailability for the patient. Thank you so much.